A new study from the CDC shows how mental health problems are actually far more common among poor people than among people who are much better off, specifically wealthier people. Now, this is sort of a no-duh study, but even with the advent of the Affordable Health Care Act, which is supposed to make healthcare more available, affordable, there are still barriers to people getting proper mental health care and mental health treatments. Now, the CDC paper, according to this paper, 8.7% of people with incomes below the poverty line, or about $20,000 for a family of 3, reported serious psychological distress from 2009 to 2013. For people with annual incomes at or above 4 times the poverty line, that's about $80,000 for a family of 3. That figure was just 1.2%. Now, researchers also discovered that 30.4% of working-age adults with serious distress had no health insurance, something that, of course, the healthcare law was supposed to correct. Now, there are a lot of reasons, of course, why this figure is so high. I imagine it has to do with efforts to, since they are poor, since they are below the poverty line, odds are that they live in a state that refused to expand Medicaid. That probably would have helped this. So let's be fair on that. Now, compared to just 20.5% of working age adults without serious distress. Now, what is this distress? Well, they looked at this, mental illness and poverty. Now, they correlate, right? Not exactly causation, although they say that causation can go both ways. Mental illness can cause poverty, and poverty can also cause mental illness. For example, somebody who loses their job has a more higher likelihood of course, developing depression. Those who are depressed may also have a harder time getting a job or keeping a job in the first place. So there is that reverse causation that can occur in both. And this, of course, study does address that. Or it doesn't address that. However, most researchers do agree that that is a factor that can work in both directions. Now, studies have also shown that people who grow up in poverty, in low-income communities, are more likely to experience the kind of toxic stress, that's what they call it, which is defined as neglect, abuse, seeing violence in the home, then that can hinder brain development. So that kind of stress, seeing that, neglect, abuse, and seeing violence can really stunt your brain. Now, I think there's also issues with malnutrition as well. And consistent, stress, not just from those other factors, but the everyday stress of being poor. Not knowing where your next meal is going to come from, not knowing if you're going to get lunch today, not knowing if you're going to have the electricity turned off. Those are major stressors. And when you do that to children, when children grow up in that environment, it of course makes all the sense in the world that that's going to harm that child. That's going to hinder that brain development. And there are studies that show that. Now, additional studies have also suggested, though not conclusively, let's be fair, that adults who become unemployed are also, as I mentioned, more likely to develop depression. At the same time, someone who had mental health problems, as I mentioned before, may have a tougher time holding on to a job, or at least a good job. And of course, without employment, it's very difficult to get health insurance to treat these, to treat depression, to treat anxiety, to treat the very things that keep you from being able to get a job. This is why I think, no, not just what I think, this is why we need a national health service. This is why we need a Medicare for all, a single payer system, so that you don't have to rely on having a job to have health insurance. Because these things hinder people greatly. Greatly. I know. I have mental illness in the family. Okay, I have family members that are afflicted with anxiety and depression. Now, somehow it skipped me, which I'm very, very thankful for. But I grew up in a household with varying degrees of seeing people in varying degrees of mental illness. So it's a very personal issue for me. And I understand, and I've seen that before, and I've seen the effects. I grew up a lot of my life in poverty related to mental illness. My mother had undiagnosed anxiety disorder for most of her life. She couldn't hold down a steady job because of it. That's not an accident. And of course, not being able to get it treated means she wasn't able to get that help that she needed to be able to be productive as she should have been, as she would have been able to do. So this is very personal. So I definitely understand the results of this study. Now, this goes into families as well. For the people and families, according to the study, that deal with mental illness, the result can be a vicious downward spiral that in worst cases ends with some combination of medical and financial catastrophe. Now, as I said, Obamacare, the Affordable Care Act, was supposed to do this. It doesn't go far enough. As I mentioned, it is a step in the right direction, but it needs to go further, especially when it comes to providing more comprehensive coverage of mental health care. Now, for example, going to the Affordable Care Act, the data in this latest CDC study doesn't actually take that into effect as much because it doesn't have enough data to capture the effect of the Affordable Care Act. But another study focusing on the provision law of the law that became effective back in 2010 found that young adults who obtained insurance were more likely to get mental health treatment. Well, yeah, you allow somebody to be able to afford insurance to treat mental health, and they can go and get mental health. And then they can be more productive because they have that under control. Now, studies of past government initiatives with similar characteristics, such as an expansion of Medicaid eligibility in Oregon, have provided yet more evidence that access to health insurance leads to better mental health. Now, there are still people under the ACA that struggle to get mental health care because they have trouble finding providers who accept insurance, or they have very high out-of-pocket costs. That's where poverty comes into play as well, and where people don't make enough, insurance premiums are too high. That's why we need that Medicare for All system. All of this points to everything that I've seen about what the Affordable Care Act doesn't do just leads me to, I'm already convinced, but it shows how much we could really benefit from a national health care system. Now, conservative critics of this say that no, we don't need more mental health care. We need to scale it back. People don't need health care. They need Jesus. And they say their main argument is that, well, if you add in mental health care, that's going to raise premiums. Yeah, that's right. But I think it's worth it to help people deal with mental illness so that they can become productive citizens. It is an investment that will pay off in the end. And I thought conservatives were supposed to be savvy about investment. But apparently, a lot of them aren't.